Is it more important to be a leader of your health or a manager of your health? Stick around to find out. Hey everyone, Dr. Ashley here. Today we're going to talk about the difference between being a leader of your health and being a manager of your health. Both are extremely important for your overall health outcomes, but you have to understand what the difference is between them and how you can put both of these roles in place into your health right now. So I didn't come up with the concept or ideas of personal leadership and personal management myself. This is actually adapted from the book 7 Habits of Highly Effective People by Stephen Covey. If you haven't read it yet, I highly recommend it. So today we're talking about habits number 2 and number 3 of this book. Habit number 2 is beginning with the end in mind, or taking a leadership role in your personal life. Habit number 3 is putting first things first, and that is taking a management role of your own life. So let's talk about how we can adapt these to our health and health goals. So in the book, Stephen Covey talks about how being a leader or leadership qualities really arise from your more emotional, creative right brain. And it is these qualities that you want to take in your own personal leadership, including with your health. This is the qualities that give you the ability to think big picture and long term. It doesn't get bogged down in the details. It's really thinking about where you want or where it wants to go in the future and the ultimate goals that it has. So it's the big picture leadership kind of side of your brain. And then the left side of your brain is the more detailed oriented, logical, sequential side that is important for those little minute details needed for effective management. So it's the day-to-day functioning coming from this management left side of your brain, and the big picture keeping us on the right road coming from your emotional, creative right brain. The thing to understand is that no matter which side of the brain we're talking about, your brain wants to keep the status quo. It does go back to the motivational triad, which is avoid pain, seek pleasure, and conserve energy. Your brain understands that you're surviving just fine right now. So anything that you are trying to change may take us away from pleasure. It might push us towards pain, and it's going to take a lot of energy. So no matter what, the brain is going to push back. And it's interesting because I see all the time in patients that I'm working one-on-one with in my clinic that the different sides of the brain will take over and use their very effective qualities to self-sabotage so that it doesn't have to change. But we're going to talk about how those sneaky self-sabotaging pieces come up and how we can get around them and really leverage what our brain is meant to do to get us to our goals. Let's first talk about the leadership role in your own health. So science in general, but especially when it comes to health and medicine, reduces whole systems and whole processes down to one tiny, tiny detail. And that is the way things are studied. So think about, for instance, nutrition. We intake such a varied diet, and all of the chemicals, micronutrients, macronutrients work together with our bodies, with the bacteria in our guts. It is such a complex and beautiful and large system. And then science comes in and tries to add one probiotic or add one supplement or change one component of your diet and introduces this idea of reductionism to the way things are and tries to say this one thing will affect the outcome. But we see over and over again that's not true. we see that if you want to lose weight, not only do you have to manage your cortisol and your stress levels, but you have to get the appropriate amount of exercise, and you have to eat appropriately, and you have to have your hormones in balance. There's so many factors, and especially the healthcare industry, the weight loss industry, all of these industries are saying this, there is one factor that is missing or responsible to get these results. Other examples would be lab values. Can we affect one lab value and have changes on the long-term outcome? Cholesterol is a great example of this. It's like, can we manipulate your cholesterol and actually reduce your risk of heart attack or stroke? Or do we also have to address everything else, including your nutrition, your insulin resistance, your stress levels? And this happens over and over with medicine. We're not looking at big picture. We're not having an idea of where we want to go. So let me give you a personal example that I have with a patient that I was working with to lose weight. So I saw her for initial visit, and I gave her recommendations, and I did want to follow her up in 6 to 12 weeks to talk about the next set of things that she would do. But of course, with busy schedules and short provider availability, we weren't able to follow up until 9 months later. I came and saw her. She had the exact same weight. And I said, well, what happened? And she said, well, I followed the diet that you recommended and I lost weight and I did great. And then I plateaued. And then I think it was Valentine's Day came up. So she went right back to her old eating habits. And so it's this idea that I need one diet, I need one pill, I need one injectable, I need one supplement. One thing is missing that will get me the results that I want, and that is rarely the case when it comes to your health. You have to take an approach of the overall system, because our body is not made up of organs that work completely individually from each other. Our brain is so intimately connected with our heart and our endocrine system and our stomach. They all are so interwoven that you have to address all of them in order to get the real health results that you want. And so instead of having this big overarching picture of where we want to go, we are being bombarded with the idea that there is just one thing that we need to focus on. And that's really what this first habit, what this first idea comes down to. So let me read you a little excerpt from the book. Each part of your life, today's behavior, tomorrow's behavior, next week's behavior, next month's behavior, can be examined in the context of the whole, of what really matters most to you. By keeping that end clearly in mind, you can make certain that whatever you do on any particular day does not violate the criteria you have defined as supremely important, and that each day of your life contributes in a meaningful way to the vision you have of your life as a whole. To begin with the end in mind means to start with a clear understanding of your destination. It means to know where you're going so that you better understand where you are now, and so that the steps you take are always in the right direction. So how are you going to take an active leadership role within your own health? You have to start with understanding where you want to go. What is your ultimate destination? And get very clear on what that looks like. And that means looking at your stress levels, looking at your sleep, looking at your movement patterns, looking at your nutrition, looking at your relationships, having a vision of what you want to be and how you want to feel in the future has to be an integral part of this process. Your brain will try to self-sabotage you here by indulging in confusion. So instead of being able to take a look, kind of zoom out and look at the big picture, see our starting spot, see our destination way down the road, way up the mountain, and just understand that that is the way we are going, your brain is going to try to indulge in confusion. It is going to say, I have no idea where the path is that actually leads from point A to point B. I want to know how we're going to do all of these things. I want to know the specific details, and we're not going to be able to figure it out. And I have no idea. And there's so many resources out there, and there's no way we're going to get that ultimate health outcome that we want. It's just indulging in confusion so that it doesn't have to actually make any changes. Don't let it. Remind yourself of what you're doing at that moment, which is just looking at the big picture and understanding, creating a clear idea, a clear vision of what you want in the future. Focus on just where you want your destination to be and have that vision in mind. And then we're going to talk about now what it means to be a manager of your health and how that vision is needed first so that you can take the management steps. Okay, so now let's discuss the management of our personal health. As we mentioned during the leadership phase, we don't want to get bogged down in reductionism, in taking big pictures and breaking them down into one single aspect. We don't want that with the leadership role in our health. We do want reductionism when it comes to the management of our health. So again, this is the left brain, sequential, logical, day-to-day activities of getting it done to fulfill what your leadership role has determined you want your outcome to be. Okay, so leadership, big picture, management, day-to-day tasks. So let me read to you what Stephen Covey says about the management role. But once you have dealt with those issues, once you have resolved them, meaning the leadership issues, you then have to manage yourself effectively to create a life congruent with your answers. Management is the breaking down, the analysis, the sequencing, the specific application, the time-bound left brain aspect of effective self-government. In other words, if you are an effective manager of yourself, your discipline comes from within. It is a function of your independent will. You are a disciple, a follower of your own deep values and their source. And you have the will, the integrity to subordinate your feelings, your impulses, your moods to those values. The successful person has the habit of doing the things failures don't like to do. They don't like doing them either necessarily, but their disliking is subordinated to the strength of their purpose. So you create your purpose and your ultimate goal outcome through your leadership role, and then the manager comes in and gets it done. What your left brain will like to do here is indulge in overwhelm. So it is going to say, in order for us to go through that forest, to climb that mountain, to get to our destination, there are so many steps we have to take. There's too much. I can't do it all at once. How in the world am I going to effectively manage all of these different things? Don't let it indulge in overwhelm. All you have to do is take one step at a time. And that's why the reductionism is so important here. Leadership, you want to take holism point of view. You want to look at everything and have a general overview. Management, reduce it down to easy, actionable steps. All right, so now that you have an idea of what in the world I mean by leadership role in your health and management role in your health, now let's next talk about how in the world do you go about doing that. The first step is understand where you're going. Begin with the end in mind. Really sit down and write out what you want your life, your health, your body, your brain, everything to look and feel like in the future. And understand that multiple steps will have to be taken, but that's not for you to worry about right now. All you want to do is just focus on where you're going for step number 1. Step number 2, break that overall vision and goal down into all of the multiple steps. I recommend doing this first into categories. So sleep, movement, nutrition, spiritual health, relationships, everything that goes into your health. You could include a financial section there. Everything that embodies your wellness and your health, break that down into its individual categories and then break that down further into steps. What you're going to have when you do all of this is a million steps. And again, your left brain is going to be like, we can't do this. This is too much. I don't even know where to start. That's okay. Just understand that is the way the brain is designed to work. It wants to resist change. And all you have to do at this point, when you have all of your multiple steps, figure out which one is the biggest domino and push it over. focus on that one task that you think will have the best impact on getting everything else done. So let me give you an example of what I would talk about with a patient. So if I have a patient who is really working on their overall health and everything is kind of a mess. Their nutrition's a mess. They're very sedentary. They're not getting any movement and their sleep is crap. What I would probably start with them is movement, just moving their body every day. And I would do so in not an overwhelming, like stick to a crazy schedule, get an hour of cardio followed by 30 minutes of weightlifting way. I would do it in a way that brings joyful movement, exposure to the natural sunlight and nature, something along those lines. And the reason is because they would feel physically better. They would likely have more energy during the day and more motivation, which would help with their nutrition goals, especially if they're not overdoing it on the exercise. And research has shown that regular movement, regular exercise will help sleep. Sleep can be a very difficult topic or difficult lifestyle area to address. So can nutrition. But movement is really not taking anything away or limiting yourself. It is truly just introducing something that can have profound effects on the other areas in your health. So that would be my recommendation. But take a look at all of your topics, all of your steps, and kind of see which one you think would give you the biggest bang for your buck, make you feel better, make you feel motivated so that you can slowly, day by day, tackle the rest of your steps to ultimate health and wellness. All right, now let's talk about my third and final step. Stick with me for this one because I do think it is the most important for actually getting you your results. So I'm going to introduce a second book for this video, and this is Deepak Chopra's The 7 Spiritual Laws of Success. This is another book that I highly recommend. It's super, super tiny. You can read it in like under an hour. And I think it's a beautiful way to remind yourself to how to act on a daily basis. But specifically, I wanted to read chapter number 3, The Law of Karma, or Cause and Effect. Karma is both action and the consequences of that action. To experience the law of karma, witness the choices you make in every moment. The best way to prepare for any moment in the future is to be fully conscious in the present. And I love this because I think it's so important that, with our leadership role, we have that overarching description of where we're going. We have our mission statement essentially for our life and for our health. And then as the manager, we have to come in and day by day not get overwhelmed with all that we have to do. And also keep in mind that that path that we're going down, the future outcome that we're getting to. And so again, I think that mindfulness is the best way not to get bogged down in the overwhelm of all that needs to happen. You have to be aware in this moment of what you're feeling and thinking. And then like we talked about, you have to subordinate, or you have to say, I acknowledge you, thoughts and emotions, but we still have to take actions to get to our ultimate goal. So we still have to be mindful of where we want to go in the future and be present with ourselves right now and still take action sometimes against what our brain really wants us to do. And that takes practice. That takes daily sitting, daily meditation, and then moment to moment awareness in all of these decisions. If you've been with me for any amount of time, or if you looked into my website, you'll see that I often say like our health boils down to the actions and the habits that we do on a daily basis. So we have to make them count. The idea of being mindful on a daily basis takes away this anxiety of, okay, I have to eat healthy today, but I also have to eat healthy tomorrow and every day for 4 years in order to get where I want to go. And I also have to exercise every day for 4 years. It takes away that pressure of doing everything all at once and says, all I have to do right now is eat something that's healthy for me and enjoy it. So practice that. I think there's a million great apps out there to do that. I would say the Jon Kabat-Zinn meditation app is a beautiful one. The Daily Calm or just Calm app is wonderful. Headspace is another wonderful one. Lots of different videos on YouTube. Just practice being mindful so that you can stop anxietying about the future, stop overwhelming about the future, and really help the manager role in you get stuff done. So if your big health outcome is weight loss, head over to my website and check out the weight loss series. If you go to selfhealingdrashley.com, you can click on the link to download my 8 steps to jumpstarting your weight loss and get going right now. But practice these steps and I promise you will get there. If you want further information on all things your brain and mindfulness and practicing awareness, check out some of my other videos, including this one that's popping up on the screen right now. That's all I have for you today. So until next time, we'll see you.